Please begin. Thank you.
Okay, thank you, Corey. Okay, first, good afternoon to everyone, and we will try to give you an update of where we are with the vaccination campaign, and we will also address your questions at the end of the presentation. So, first, I want to share with you that until early this morning, the total number of vaccination doses administered here in Clark County was 107,000. Those vaccinations have been administered by the health district staff and our partners across the county, the different cities, City of Las Vegas, Henderson, North Las Vegas, also our partners at the universities, UNLV, Roseman, Toro, as well as all the hospitals in the area and other providers. It has been a common effort across the county to be able to deliver those shots. We, as some of you might know, we are struggling with the number of vaccines that we are receiving in weekly basis, and this is also something that is limiting our ability to offer more vaccination to our community, and it has been shared before by Chief Steinberg and many of our partners, and we just want to emphasize that we have enough capacity here to administer more vaccines that we're doing right now. We estimate that we have between 95 and 105,000 vaccines doses that we could administer through our sites here in the county. But right now, our allocations are very limited. We are receiving about 23,000 doses of vaccine a week. So it's important to share that with you, because we know that there are many questions about when will I be vaccinated. Most of our residents are asking that question. I also want to mention that the health district, in partnership with the Las Vegas Convention Center, will start offering the second dose of vaccine to all those who receive the first dose at health district locations and also the Cashman Center. So basically it refers to three locations: Cashman, the main facility of the health district at and Western High School. Everybody else who received the first dose at any of our partners, they are scheduled or will be scheduled to receive the second dose at those locations. So it's important to clarify that. And also we will be offering the second dose of vaccine at the convention center for the next a few weeks. And once we receive a larger shipments of vaccine, then a second dose of the vaccine will be offered at multiple sites beyond the convention center and the initial places where people might have received the vaccine. I also wanted to briefly touch the issue of the new variant that was identified here in Clark County. It was reported by the state public health lab this week. There was a patient, a female in her 30s, that was diagnosed with COVID. But when our lab here in Southern Nevada start looking at the specimen from this patient, they noticed that there were certain elements in the structure of the virus that weren't consistent with what we have usually seen. And because of that, this specimen was transfer to the lab in Reno because they have the capability to do more advanced studies. And that's how this strain was identified. This is the strain that is currently circulating in the UK. It's called the B7 strain, which is considered to be more aggressive in terms of ability to disseminate and spread the disease among people, but it's not considered to be more lethal of generating more complications when compared to the usual variants that we have here in Southern Nevada. The preventive measures for this new strain remain the same that we recommend for this disease from the beginning of the pandemic. Again, keeping social distancing, at least 6 feet distance when we are in public places. Also, the use of facial covering or mask and hand washing, as well as other mitigation measures that we have been advocating through this year. Okay, having said this, I will stop here. I will ask Councilman Scott Black, who is the chairman of our Board of Health, to participate in this. Thank you.
Thank you so much, Dr. Ligon. The Southern Nevada Health District has all along and continues to work closely with our jurisdictional partners as we work through this vaccine rollout process. And our goal is to make sure that everyone who desires a vaccine that is currently eligible to receive it through the lane program that we have, that they will receive it. That's our absolute goal. Dr. Ligon mentioned that throughout our community, we have developed a capacity to administer much higher amount of doses to our community than we have the supply to support that. And the good news is, as the supply, we are certainly able to scale up for our community and really fulfill the needs and maximize the distribution to our community. We're working closely with the state, who is working closely with the CDC and FEMA and our federal delegation to increase the doses available for Southern Nevada. And as those dosage amounts increase, we're certainly ready to take those doses. They won't sit, they'll be put out into the community and into the arms of those individuals that desire and are eligible for the vaccine. I think it's important to note that this is, of course, an unprecedented set of circumstances that we're facing. It's a community-wide undertaking, and our efforts as a health district, along with all of our partners, both public and private, are really making it possible to do what we're doing. You may ask yourself, Dr. Ligon, he's the doctor here, and he mentioned a moment ago, what can we do as individuals? Clearly, all along, we've been asked to wear a mask in public, to wash our hands thoroughly and frequently, to socially distance when in public. He mentioned those things. Those things are so critical to maintain and continue. And one more thing that you can do as a community member, as your eligibility comes up, to please take the opportunity to sign up and register for an appointment to receive the vaccine. If we all continue to do these things together, we'll be able to collectively stop the pandemic here in Southern Nevada and open up for business and get back to normal. So thank you so much, Dr. Ligon and your team, for your excellent work, and for all of our community partners for their leadership and help.
Dr. Ligon, you're muted.
Sorry, thank you. Okay, thank you, Councilman Black. I will ask Chief Steinbeck to proceed.
Dr. Ligon, I don't have any comments. I'm just here to answer any questions that might come up. Thank you.
Okay, thank you. Okay, then we go to Joanne Piper. She's our Chief Administrative Nurse, and she has been leading the vaccination campaign for the health district. Joanne, please.
Well, good afternoon, everyone, and thank you for attending our media events so that we can get the information out. Things seem to be improving every week, and our capacity is really coming along very well. We just need vaccine, and we will be able to vaccinate this community and get everyone back to work.
Okay, thank you. Corey, would you please open for questions?
Yes, sir. Our first question today comes from Ms. Jacqueline Schultz. Please go ahead. Jacqueline, are you there? Okay, we'll try with Jacqueline again in just 1 second. Let's go to Lauren Clark from Channel 3. Unmuting you now. Lauren, are you there? All right, we may be experiencing some technical difficulties. Let's keep going down the list until we hear somebody. Okay, Joe, you're up next.
All right, can you hear me, everybody?
Yes, sir.
All right, there we go. Today I noticed that Walgreens is actually on the appointments for the vaccine. Are you able to talk about more locations such as pharmacies opening up this week when it comes to getting the vaccine option now? Because Smith's is on there, so is Walgreens, but we haven't really seen much or heard much about them.
Okay, thank you. Joanne, you want to take that?
Sure. So some of the pharmacies are receiving vaccine, and their target population is 70 and up. And Walgreens and CVS have started appointments, and more are to come. Save-On is coming on. Smith's is also an option, and you can reach those appointments at nevadacovidfighter.org.
Let's try Jacqueline again, see if we can hear her this time. Are you there, Jacqueline? Okay, still having trouble. Let's try Lauren again. Lauren, is it working? Okay, I'll try you again. Jacqueline typed her question into the chat box. What's the prospect and timeline for getting through the next tiers? Are we going to focus on the current groups?
Okay, I will start, and Joanne, you do that after that. Well, right now we are working through 70 years old and over. And just to give you a perspective, the total number of seniors that we have in that group in Clark County is over 200,000 people. So it's important to keep that perspective. At the same time, we are working with the second lane, which is the workforce. We are vaccinating healthcare providers. Still, we're vaccinating healthcare providers. We are also vaccinating responders within the safety group, and also we are vaccinating members of the frontline workforce, such as educators, also members of another priority group that they are working closely with people with special needs, and then what is the other group that we had, Joanne? Because we stop at the governance, which is the
Right.
who
Yeah,
work at the county. Yes, go ahead.
Yeah, between governance and transportation, that's where the cutoff is for the essential worker. On the other side is 70 and up on the age side. So those are the groups that we're vaccinating right now. I would expect, since it is a large group, Clark County School District itself is like 40 to 50,000 people. So I would expect that we would be staying there for at least a couple of weeks.
Next up today is Mary Hines.
Can you hear me?
Mm-hmm.
Okay, great. I'm wondering, in terms of who is eligible right now, if anyone who works in a healthcare office in any capacity can be vaccinated right now? And can anyone who works in a school in any capacity be vaccinated right now?
Well, as far as medical, yes, they can be vaccinated. For school, it depends because that's a newer group. And so I think there is a plan for CCSD working with UNLV to get a plan. There may be some limitations there. I think, I can't say for Clark County School District, but my understanding there is a vaccination plan, and they do have groups that they are prioritizing.
Right, Joan, let me add into that. Regarding the school system, the short answer is everybody who's working at the school system, whether it is private schools or Clark County School District, they are eligible to be vaccinated at this phase. Specifically for Clark County School District, they created their own priority groups, if you wish, and based on that priority groups, they are being vaccinated today. Thank you. Got it.
Lauren from Channel 3 has asked her question in the chat box. When can residents expect to move to the next lanes? So like the 65 and older, 65 to 69 group, when will they expect to be eligible?
Okay. We, as I mentioned before, we have over 200 people in Clark County who are 70 years old and over, and we are receiving about 22,000 doses of vaccine a week. So unless the allocation of vaccine change and we do not have control over that, we are several weeks, I would say, before we can actually move into the next group. And it's not because we don't want to, it's just because there is no vaccine. Thank you.
Yeah, our next voice question comes from Alexander Zapata. I'm unmuting you now.
Dr. Leguén, ¿me escucha?
Sí.
My question is going to be in Spanish, sorry. Dr. Leguén, si nos pudiera...
Hold on.
Okay.
Corey said that Spanish will be at the end. I don't want to violate what he already said, and so
that's great. I can wait. Don't worry.
Okay. Yeah, thank you.
We'll definitely come back to you. I promise. Okay, let's go on to Astrid Mendez. Unmuting you now. There you go.
Hello, everyone. Since you were talking about the teachers' vaccination, actually CCSC released, basically a memo to their employees saying that now that they can register to get access to the vaccine. I was wondering what is the relationship that you're having with them about it? If there's already like an established number of vaccines that have been already allocated to them. Obviously, they need to prove that they're employees with CCSC, but of course, there's still a lot of questions about how many can they do this? They have this.
Joan?
Sure. I mean, keep in mind, we're getting, like Dr. Leguén said, we're getting anywhere from 22 to 25,000 per week. So UNLV is actually managing CCSD. So that email, I think, was a couple of weeks ago. So I think there's a newer plan. And I think they are prioritizing their list, just like we did with the hospitals, where we prioritize those who would be, on the front lines. That's what I understand CCSD is doing. So employees really should wait from guidance. If they work for a large organization, they should go to their employer and say, is there a vaccination plan? And that is the best approach at this point.
Jeff Gillan, you're up next.
Good afternoon, everybody. This is for anyone at the Health District. Perhaps Joanne, you could weigh in on this, or Scott Black. But could you walk me through if and when you get more vaccine, just exactly how you would be able to scale up and what the plans would be, what that would mean? What would that be? 24-hour sites? Would that be drive-through sites? Just exactly what would you do with more vaccine?
Sure. I'm actually looking at my spreadsheet right now on this issue. So with the capacity we have right now, we could probably do about 80,000 per week. Our goal is around 100,000 per week. Now we have to consider the second dose in there, but I'm pretty confident we can certainly do 50,000 per week with our current capacity. As we build our capacity, we're looking at 100,000 per week in March.
And Joanne, what Jeff alluded to also are also potential scenarios for us, such as 24-hour sites, drive-through sites,
yes.
all those things that he mentioned are all prospective aspects to our plan as we scale up. But the existing capacity that we have is what Joanne indicated, you know, well into the tens of thousands, upwards of 80,000. We're just working closely with the state, with the federal government to up our allocation. And once we do that, we'll be able to incorporate more large scale pods, mega pods, if you will, more strike team aspects to areas of the community that have mobility issues, potentially 24-hour sites. All those things that you mentioned will be part of our multi-pronged approach to reach everybody as quickly as possible.
We have 2 large pods right now. One's doing first dose, one's doing second dose. At Las Vegas Convention Center is second dose, Cashman is first dose. And then we have the capacity here at the Health District and all of our partners. With just that capacity, it's around 40, 50,000. So that's just operating 5 days a week, eight hours a day. That's not even doing 24 hours. So with another 2 large pods to do the second doses, we would easily be able to do that capacity, and without even having to do the 24-hour thing. So we have a lot of vaccinators here. We're getting some help from FEMA, National Guard. The fire department's been awesome helping us out with this. And so when we're ready to really open up for the public, we'll be ready around March, April for that.
Yeah, thank you.
Maybe May.
Would you like to add to that from your perspective?
I'm sorry, Dr. Legan, was that for me?
Oh, yeah, I was asking would you like to add to that?
Yeah, sure, absolutely. So I agree with Joanne. I think that, in fact, I'm even more optimistic on the numbers there a little bit as we take a look at the spreadsheets there. Our SNHD, so just the sites that SNHD is supporting shows 94,370 today. Those numbers continue to be adjusted. So we really think we could put that together and be pushing that out each week, starting today if we had the additional vaccines. Certainly, as well, you know, to the more general question, how would we, for instance, Cashman site? It's running just over 1,000 now. It's only because of vaccine limitations. That would instantly be up to over 3,000 a day. You look at that scale all the way across at the different sites, everybody can do more. And that is, just like Joanne said, without expanding hours and without expanding additional sites. And certainly the model that's at Cashman, at Canyon Springs, and at even some of the smaller pods can be replicated now. So it's a resource request. We add additional personnel there, and we can have multiple sites like that. So the question that, have we considered drive-through sites? Yes, absolutely. We have plans in place to do drive-through sites if that's going to be the best operation for us, but there just hasn't been the vaccine to enact those. And we've had a tremendous response from the community of offering sites. So everything from public to private locations. This is what people want right now. The community wants to provide this. So we get calls all the time of, hey, how about this site? How about that site? We'll do whatever we can for you. and we'd love to take advantage of that, but none of it matters without additional vaccine quantities.
Right. Thank you, Chief. I would also like to add to Joanne and Chief comments that another opportunity that we have here is our partnership with the private industry that we haven't incorporate into our response, but there is a willingness to participate on this, and we certainly will reach out to them when we are in a position to administer more vaccines. Thank you.
We've had in the chat box specifically for Joanne. People wanted to clarify something that was said earlier. Rhonda Press just wants to clarify that the following folks in the frontline community support lane are still not eligible: essential public transportation, mortuary services, and remaining essential public health workforce. She says rideshare drivers have been turned away, they've heard.
That's correct, yes. There was some confusion about the transportation, what exactly that meant. For essential public transportation, it meant ground transportation when you look at the definitions. And if you go to our website and click on that section, it'll give the definition. But essential transportation means like bus drivers, that type of thing, and ride share. And we're cutting it off right there. We have to cut it off somewhere so that we can concentrate on the other priority groups up ahead.
We've also had a couple of questions in the chat asking about when people are going to be getting their emails about the second doses and so forth. And our communications manager has been responding to those. So I just want to recap for anyone who's not seeing the chat. She was saying that the emails have already been distributed and people did receive a link to schedule an appointment. There was another question about our changing our appointment system and why we did that. And we said the new system will integrate both the appointment and the registration process, so people don't have to complete the registration paperwork on site, and it'll speed up the process and cut down on data entry. Did anybody want to expand upon any of that?
Right, our system, basically we went to an electronic system on site at the clinics. So the appointment was the initiation to that system, so that information in electronically, and we can get it also up to Nevada WebIZ quicker, so we can get our data entry completed on site.
Lauren Clark is also asking, aside from neighbors reaching out to eligible non-long-term living care seniors, are there any strike teams, additional resources helping them make an appointment? Many have expressed lack of internet or computer.
I lost Corey.
Corey.
Did you hear me? Did you hear any of that?
No, we lost
A bit of it, talking about long-term care and reaching out. Yeah. So
there were any strike teams or resources? Because I guess some have expressed lack of internet or computer access.
Right. So the long-term care, like, for example, like nursing homes, assisted living, those were taken care of by the pharmacies and CVS and Walgreens. Now, there were some of those places that didn't qualify with that federal program, but now the state is setting up those pharmacies to go to those others that did not qualify. So that's another group that will be taken care of. And we are asking neighbors and family members to help their loved ones over 70 get appointments. We do have a phone number for appointments at this time for those second doses. When we get that center up their capacity, and also we're working with the state on their phone number to assist over 70, then we'll let the media know and let our folks know. A lot of the over 70 groups through the senior centers are getting direct access through the senior centers. They have lists of people and help them. But we do need to do some work on this to get more outreach.
Jeff Gillan's following up with the question, the capacity that we currently have, 40 to 50,000, Is that per week? Are we administering all of it? And with more, could you take that up to 100,000 doses per week?
So right now we have a capacity of the whole of Southern Nevada of around 20 to 25,000, somewhere in there. That's what we're allocated. Our capacity is much higher. It's twice that. So that is not the issue. It's getting the vaccine from the federal government. So our capacity probably is more, I'm looking here, probably a 60,000. And with a few more pods, we could easily, I think, get it up to 100,000. I think Chief Steinbeck would say yes. And that's where we are. We have to consider how we're going to do second dose. So we would actually need a capacity of 200,000 per week if we wanted to do that.
And Astrid Mendez has follow-up questions. How many vaccines are allocated to CCSD?
That was already answered. I mean,
yeah, I am not sure how much UNLV is getting, but as all of Southern Nevada, we're getting 25,000. So there's not a specific allocation for CCSD, but UNLV, it really is based on their capacity and how much they order.
Okay, right now we don't have any more raised hands or questions in the chat box. So in a moment, we will move on to the Spanish language questions. But first, does anybody have any wrap-up comments before we move on?
Hey, just on behalf of committee, she was unable to unmute and to join us today. So she just wanted to give her support to all of the community partners that are assisting with this effort. And let everybody know that she is pushing as hard as possible and working as hard as possible on behalf of our community to get more vaccines to our community that we can push out in mass. Thank you.